Greetings, listeners. This is Chris Frederick with the Stretch to Win Institute at stretchtowin.com. I'm really excited to be here with Rich Jacobs today, one of my graduates, a fascial stretch therapist specialist. He'll tell you all about that. But he took a different path. He's still doing that. He's still doing FST, I understand, but he took a different path, and it's a path that I think everyone should hear about because it's a topic or a subject or a profession that is really in the news today more and more, and it's a place where we can refer our clients, and it may be one of those, it may be the answer to why your client is not making progress. So without further ado, this here is Rich Jacobs coming online. Hello, Rich.
Hey, Chris. I appreciate you having me on. Thank you.
You're welcome. So let's just go for it. Tell us about what you do. How's that?
All right. Well, as I said earlier, I'm a level 3 stretch therapist with you guys, and I have continued to go a different route, more into functional medicine. Specifically, I'm a Functional Diagnostic Nutrition Practitioner. And what that is doing is finding the root cause of common health issues, such as fatigue, sleep issues, and inflammation. And there's been a great bridge that I've gapped with stretch therapy and FDN, where some clients weren't getting results. I looked deeper into their inflammation, what was going on, solved those issues, and suddenly their flexibility actually increased.
That's awesome, in addition to probably other things.
Yes, yeah, and we can talk about that, absolutely.
So, would functional medicine be the proper term to use in general, as a general category with what you're involved in? Okay.
Yeah, functional medicine is very general.
It is.
There's the Institute for Functional Medicine, which I've taken their main course.
Can you help us? And maybe let's just start with Functional Medicine 101.
Mm-hmm.
You know, basics, we don't know anything. Please inform us about what is functional medicine, and you're saying that's very general, so maybe help us, okay, after functional medicine as a general topic, is there something underneath it, or is it subdivided? Just help us out there.
Okay. Functional medicine is a different way, a more holistic way of looking at the human body. So if we compare to, say, modern medicine, you go into the doctor, you have a symptom, they treat the symptom, you move on. They don't actually look at the root cause of why that symptom occurred, or maybe how long ago or what built up to that symptom occurring. Functional medicine is more of we'll look at a timeline from the day you were born all the way up until now and look for those clues that may have pushed you into unexplained weight gain, sleep issues, gut issues. And then instead of just treating the actual symptoms that you're feeling, we'll find out why they're actually occurring. Treat the reason why they're occurring, the symptoms will go away. And in a nutshell, that's functional medicine.
Okay. So I have a feeling, I kind of think my intuition is correct here, that you have a little personal story. We didn't talk about this, listeners. I'm just throwing this on Rich, and it's up to Rich to share it or not, or to what extent. But I think there's a personal story behind all this and why you went in that direction. And now obviously it's a passion, and that's exciting, but lots of passions start with a personal story, some shift in your life, you know, your health, whatever. Do you care to share any of that?
Yeah, absolutely. I mean, I write about it, and that's really what I tell people why I do what I do. So probably about 4 years ago now, I just had a very, very stressful time in my life. I made a move, was in a bad relationship, and I was actually doing a physique show at the same time. So a lot of big stressors going on in my life. Oh, and I got pneumonia. So my body was basically shutting down, and I had libido issues, I had gut issues, I actually had some weight gain issues, fatigue, like you name it, I had it. I did go to the doctor, I did all the typical stuff that we all do normally, and they said everything was fine. Like all the blood results came back normal, and I was fine. Obviously, I didn't feel fine. He gave me a couple of drugs that might mask the symptoms, but they didn't actually take care of the problem. That's when I found Functional Diagnostic Nutrition, and not only did I work with a mentor to heal myself and feel better, obviously today I feel great, but then I also learned how to do that for other people. And it's really, as you know, Chris, I've been a strength and conditioning coach for, 15 years. So really just working on the body on the outside, and now transitioning to working out with the body on the inside has really been a relief, because I've really been able to help people who went through everything I went through, are on a lot of drugs. The doctor said everything's fine. They think they're crazy, and I'm telling them they're not. And we actually find out what's wrong, and now they feel great.
Yeah, I'm so excited about this. I'm really excited to have you, because I've been involved in, I'll just call it natural healing, general category, for decades, actually ever since I was a little boy. And because we used to follow the teachings of a Swiss naturopathic physician. And I still have his old books, and one's written in German. And I tried natural remedies on my father, and it worked. I tried it on a couple of things that were going on with me. It worked. Just from a very layperson, perspective. Literally using food in different forms to heal. It was crazy. And so that started my interest, and dabbled in and out of it over the years. And so I'm really happy to talk to someone who's, a professional in it. I've seen naturopathic physicians. I think it's a little confusing. It's like, who do we see out there? Naturopathic physicians claim to be, and with all due respect to naturopathic or naturopathic medicine, they claim to be, sort of working more holistically or with the whole body systems. But my complaint about a lot of them is they're turning into just like MDs. I don't see, almost not even seeing a difference with some of them. They're very biochemically oriented, which is good, which is fine. You need to be biochemically oriented, but they don't look at you. They don't really touch you. There's no contact at all. And some of them just deal with lab values, and that's it, which is fine. Okay, be honest. If that's all you're going to look at with me, good. I mean, you can learn a lot from lab values, but if someone is still not responding, then you need to go a little further. So I don't know if you want to make any comments about that.
Yeah, absolutely. I do use labs. I got like my core functional labs that I use to look at hormones and gut and food allergies and the state of the gut, right? However, I also have some really deep assessments to have that clinical correlation between what the client is actually feeling and what is going on in the body, and using the two of those together and treat that. So you're really treating the person as a whole. And what's really unique about what I do is that I actually don't have to be in the room with that person. Because of how I function and how this works, I can do what I'm doing with you and treat somebody through Skype. Because everything now, I can send labs from the lab and have them mailed back, and all the assessments are through email. And
so you can literally have a client anywhere in the world.
Yes, absolutely.
That's outstanding. Do you have any clients anywhere?
Very effective.
Do you have any clients anywhere outside of where you live?
Oh, yeah. I've got clients in L.A., Chicago.
That's awesome.
Maybe one in New York coming up. So, yeah, I mean, from one end of the country to the other.
Okay. Well, enlighten us. Why would I see you versus my naturopathic physician? Not to put it up against you, like making it a competition kind of thing, but what does the functional medicine aspects of things, or how you, I think we're all a little confused about what's the difference between a naturopathic physician, and a lot of people call themselves functional medicine, this and that. Can you clarify a little bit, like what maybe if you don't know what they're all doing, because it could be, some are certified, some are not certified, sometimes it's a garbage can term now, unfortunately, because everyone's jumping on the bandwagon of functional medicine, right? Just like fascia. Yeah. Can you clarify for us what your training is, and maybe why you went that way? Because you found a mentor, because you had lots of choices, right? And you went on that search, and you landed on something, the mentor and that kind of training that really, really helped you. So I want to know about that, as opposed to going somewhere else. Like, what makes that different?
Okay, yeah, I mean, there are definitely options out there. I'd say we'll talk about the differences. So, an MD is an MD, and they definitely have their specialties. And let me tell you, if I'm vomiting with 104 fever, I'm going to go to an MD, right? There's definitely use for that. And then you have the the holistic medicine people, which is going to be your acupuncturists, chiropractors, naturopaths. And you keep talking about naturopaths, so I'll focus on that for a second. They're actually very similar to an MD, except they have, they're going to look to supplements and nutrition to heal versus pharmaceutical. But they're not always necessarily looking for the root cause.
Oh,
They
really?
still have that,
See,
yeah, they
that's
still have
what
that mindset
okay.
of let's just treat the symptom. Unless they go more of a functional medicine mentality, which a lot of them are doing now.
Okay.
And so you see a lot of MDs and naturopaths going to what's called the Institute for Functional Medicine, and that probably takes about a year long of taking courses and then having to get certified. There is Functional Diagnostic Nutrition, which is very in-depth learning. And then there's the Kalish method, which is another certification similar to FDN. And those are really the big ones out there.
Mm-hmm.
So if you're looking for somebody near you, then you definitely want to look for that FDN or the Kalish method or IFM.
Okay.
Those are really the only three that do good functional medicine work.
Awesome. All right. Let me ask you a question. A lot of the FST practitioners and other people out there, we would love to know, when do we refer? Because, okay, I'll take me as an example. It's like I recognize what my limitations, my scope of practice, and then at a certain point I have a client and I realize they need something more. It's something inside, as you put it, right?
Mm-hmm.
And so it's like, who do I refer to, or when do I know? Is there anything that us as practitioners we can add to our intake form, like a series of questions? Is one thing that would be the subjective, and then is there anything objective that's like, these are three things you can't put everything into a box or category, but what are we looking for? So I'll just start off subjective. I ask all of my clients subjectively, especially with pain, when was the last time do you sleep well? Do you wake up feeling refreshed, like you had a full night's sleep? And this is especially, I ask this with chronic pain. And B, when was the last time you remember waking up refreshed? And oftentimes with chronic pain, they say, I cannot remember. So I'm thinking years of sleep deprivation, they're not going to heal.
Correct.
Because they're not sleeping. That was kind of I call it layperson's functional medicine question, Because a lot of times FST works by stimulating the parasympathetic nervous system. The client gets to sleep, and now they start to get better.
Yep.
And so I've learned that over the years. I know that sleep is so important, but it's not the only answer. There are other things. So with chronic pain, that's one of my examples. Is there anything we should add besides maybe that question or something else?
Yeah, it's going to get a little deeper, and it's going to be to the comfort level of the practitioner, whether you're training in massage therapy or, obviously there's a lot of professionals that come through FST. Talk about maybe night sweats.
You know what? Keep it basic, because if I hear 5 out of 5, if I hear 5 out of 5 questions are yes, positive, as a red flag, I'm like, you know what? They got to go see FDNP. They need to see you. You know what I mean? I'm not going to make progress with this person. All I want is maybe 3 questions that we should all be asking. How about that? Just make it easy for you, because I know questions can go on forever. Let's pick three ones that come to mind that you think could be very helpful to ask. And it's like, it makes in our head, okay, there's some red flags here. I'll keep this in mind. And if they're not making progress within a few sessions and they're extremely painful, they feel like they're inflamed, I think I better send them to Rich Jacobs.
Okay. Morning fatigue is a big one. Craving sweets or salt is a big one.
Wow.
Unexplained food allergies. A lot of people say, I've never been allergic to this before. Now I am.
Mm-hmm.
Bloating after eating. I would say those are some big, I know you asked for 3, but 4.
Yeah, it's fine. Whatever you think of. Good.
Yeah.
Because it's things like that I want to add to my intake. I want my graduates to think about adding to their intake and start thinking functional medicine. Start thinking of what else could be going on with this person on the inside, things that you can't see or things they don't reveal. And I guess the other thing would be, let's go move into objective like tests. We all do range of motion, off the table functional tests, squats, and other things, and then we get them on the table. It's like this person, for me, I'm like, this person's inflamed.
Mm-hmm.
You know what I mean? It's not just one injury. Their whole body is inflamed. I feel it in the tissue. Can you speak on that?
Yeah, you definitely, yeah, you can feel inflammation, I agree. It's usually, the puffiness, or you feel, you go from R0 and then to R1, and you're like, whoa, I don't feel like we should be at R1 yet. That could be inflammation. Those would be the two big objective ones. And once you start looking at their body, right, dark circles under the eyes, skin issues, those can be, objective. Obviously, there's something going on with the detoxification system.
Mm-hmm. Yeah, and I see some people, they're sweating already. They're coming in, they're already, their sympathetic system is in overdrive.
Yeah, or the hard skin, that would be inflammation as well.
So I think, things like that, it's funny, when you're taught to find when you look at the forest and you see trees, and then a hunter or a guide says, "You don't see that deer?" It's like, well, I'm urban, I'm from the city. No, I don't see a deer. Well, look over there, right? Look a little close. Oh, yeah, now I see it. So it's the same thing with clients coming in. They could be sallow yellow looking in their skin, almost like a real deficiency.
Yeah.
And then you see the opposite. You see excessive puffiness, like yin and yang. You see puffiness, you see redness, you see sweating. And then you see, like, on the table, if you're stretching them, they get, like you said, they're very reactive, very sensitive to what you're doing. It's like they hurt.
Yeah. And there are some people that just do hurt with whatever you do. But normally there should be a gradient there.
Yeah, so I think if FST practitioners and others who listen to this open up their senses of their vision, their observation skills a little bit deeper to look for these things, you start seeing things that really tell a story about the person. Rather quickly, you should be able to see it when they walk in the door. And then when you get really their body in your hands as an FST practitioner, moving them, it tells you so much more. You'll know within the first session, an experienced person's like, they're going to need more than me.
Yeah, absolutely. I have a client that I worked on 2 days a week for quite a few months, and we had some progress, but not as much as I feel we should have gotten. And then we did some lab testing and assessments, and we did, the FDN stuff, and found out that he was just too stressed out and very inflamed, and so we implemented a protocol to basically bring down inflammation. All of a sudden, pain goes away, flexibility increases, range of motion. It was fantastic.
Would it be accurate to state that an X% of people that you see on average are indeed living an inflamed life or have, you know what I'm saying? Would you?
I mean, I think nowadays we're all living somewhat an inflamed life with the quality of the air, the amount of stress that we have. Everything's on a deadline.
So kind of everyone is a suspect for inflammation. I would put it that way, right?
It depends.
It's almost like it's funny. I'm thinking, prove me wrong. When someone comes in, I'm thinking to myself, I don't say this to the client, prove me wrong that you're not inflamed.
Yeah.
Because you're coming to me with a problem, so you have a problem. And so I'm thinking, okay, is it from inflammation? Systemic.
Yeah.
Systemic. I know you could have an injury in that knee, but is it systemic, right?
Right, and of course age makes a difference too.
Yeah, so that's very helpful to think of it that way. I think when people start thinking of it that way, it's like, oh, I never thought of it that way. And so I can think of my clients a little differently and help them faster and not waste time, not see them 5-10 sessions knocking at the door and they're not making improvement.
Right. I mean, we all want to be effective as quickly as possible because we want to help people. And we hate taking people's money if they're not getting help. So we want to help them. So yeah, absolutely.
So what's the scope of practice of a FDNP? Is that right?
Yeah, FDNP. So the scope is that we can't diagnose, right, because we're not doctors.
Okay.
What we can do is find those hidden causes, and through the lab work and assessments, we can help that client clinically correlate, and they can see that their symptoms are coming from low testosterone or low cortisol. The correlation is very important. As far as prescription meds, no, we can't do that either, because again, we're not a doctor, but we do have a large access to supplements, antimicrobials, cortisol balancers, things that could be harmful if you don't know how to use them properly. So people going to Dr. Google can end up messing themselves up a little more. They should get some help on that.
Yeah, well, thanks for sharing all that. And I have to tell you, along those lines, I tried a few things years ago when I was in practice. I bought Zyflamend, which was I forgot the proper term, but it's supposed to help inflammation. And I got it from Whole Foods. And I bought a bunch. And I thought I'd resell it to clients who could use it. I had one lady take it. She went to the emergency room. And I took it all back to Whole Foods. I was like, I'll never do over-the-counter, just selling an anti-inflammatory of any kind again. I will never do that again as a non-functional medicine person or whatever, because some people could be reactive. And why am I taking that liability upon myself? It's like, you know what? Send them to the proper practitioner. So all of you listeners, if you have things there and you're just advising people, just this can help and this can help. You don't know it can help because you haven't done the tests. You haven't done the blood tests. You haven't done all these other tests. I don't think it's good just to suggest things over the counter, or even just go Whole Foods and talk to them. They don't know. I mean, they're just into selling supplements and things. They're very nice and very helpful. But you need to see a professional like you, Rich Jacobs, and any of the practitioners that are trained under the functional medicine or the places you mentioned to really get proper testing. Would you not agree?
Oh, absolutely. I think supplements are just as dangerous as pharmaceuticals.
Yeah. I think taking just supplements all the time can throw your biochemistry off.
Yeah, if you take too much, too often, that can be a liver overload, right? Everything goes through the liver, and that can cause issues as well.
And there's quality and standards in supplements, and people buy the so-called cheap ones because it's a good price from Costco or some other place.
Right.
They have fillers, they have excipients, they have all these other binders and things that you may react against. You may be sensitive or allergic to the other things that make the pill.
Yeah, now we've seen all the news reports come out, how you're not getting what you're paying for in supplements.
Yeah.
So that's why it's really difficult for me to advocate people going out and getting them from Whole Foods or Sprouts or any of those places.
Yeah.
Costco.
Well, listen, we're going to draw our interview to a close because we can subdivide this out into different categories in the future. If you're interested, I think there's so much to talk about and to educate our practitioners and the public. And I think next time I'd like to talk a lot more just about inflammation and about toxicity, about detox, about the things we're exposed to. That would be another separate one because there's so much to talk about. And just get more educated, especially for my FST practitioners. I hope that you guys have learned a bit about maybe adding some more questions to your screening about what people are, if they're sleeping well, if they have any reactions, and so on and so forth. It can slow down your treatments. It can stop them making progress because things are going on the inside that we can't see. We need testing, and professionals like Rich Jacobs can help our clients get better faster. So any other words of wisdom before we close?
If you want a free sleep report, I actually have that available on my website. If you don't mind me plugging that.
Not at all, please.
It's at richjacobsfdn.com, and just wait for the pop-up. You'll get your free report.
Okay. And is that where they can reach you in case they're interested in maybe ask you, whether they can see you as a client?
Absolutely. There are links for a free consult because I want to make sure that they'd be a good fit and that we'd work well together first.
That's awesome. That makes a lot of sense. So repeat your website again.
It's richjacobsfdn.com.
Perfect. Well, thanks so much for your time, Rich. You enlightened us about functional medicine as a general category and what you do. as a diagnostic, let me see, it's right here, Functional Diagnostic Nutrition Practitioner. It's a lot to say.
Yeah, that's why I would just go with FDN.
FDN. Congratulations on your fairly new life path, and I wish you the best with that. And listeners, I encourage you to refer your clients. If you're not making progress with your client or yourself, contact Rich, see if you guys are a good fit, and move on from there. Rich will be happy to help those who are a good fit and learn a lot more about how the inside of your body has a lot to do with the outside, what you see and what you're doing in your life. So thanks again, Rich, for your time.
Thank you. Appreciate it.
And to all your listeners, we'll be in contact and seeing you again soon. Thank you so much for listening. Take care. Bye-bye.